It's 3:30, so we'll come to order. Thank you all for being here again. This afternoon, I'd like to first begin by acknowledging that we're meeting today on the unceded lands of the Algonquin people, for which we're very grateful. And today we have two topics on the agenda. The first is to hear from Cindy Blackstock, the Executive Director of First Nations Child and Family Caring Society of Canada, to discuss Supplementary Estimates A 2016-2017. And then in the second hour, we'll be hearing from Regional Chief Isidore Day from Ontario regarding the suicide study. So we will just jump right in by welcoming Cindy Blackstock. It's very wonderful to have you with us today. I'm happy to give you 10 minutes to share your thoughts with the group, after which we'll have rounds of questions. When there's a minute left, I'm going to hold up a yellow card so you know we're nearing the end, and then when I hold up the red, please try to draw to a close. And without further ado, Cindy, you've got the floor.
Great. Thank you very much, members, for having me here today. I too would like to join in a recognition of the unceded Algonquin territory and recognize Regional Chief Bill Erasmus, who is with me today. We're here at a moment of Canada's history that many of our ancestors collectively prayed for. That time when we would reach out and embrace the reality that the federal government is racially discriminating against First Nations children as a fiscal policy, and have the opportunity to stop that practice and together raise a generation of First Nations children that don't have to recover from their childhoods, and a generation of non-Aboriginal children that never have to grow up to say they're sorry. The undisputed facts are these, is that in 2007, the Assembly of First Nations and the Caring Society filed a complaint against the federal government. There was two allegations. Number one, that the federal government failed to implement equitable child welfare services for First Nations children on reserve and in the Yukon Territory, and that inequality was known to the federal government. They agreed with it. They had solutions to remedy it and failed to do so, and thus it was perpetuating racial discrimination in one of the worst ways. As the tribunal would later say, it incentivized, in fact led to, the removals of children from their families, similar to ways during the residential school era. The second allegation is with regard to access to public services. First Nations children are often denied, delayed, or disrupted in their access to public services available to all other children because of jurisdictional payments disputes within the federal government or between the federal government and other levels of government. This has been going on for many decades, and Jordan's principle is intended so that First Nations children can access services on the same terms as other children. It was passed by the House of Commons in Motion 296 in 2007. In December. That should have been the end of these disruptions and denials of services, but unfortunately, it was never properly implemented. There were two findings from the case, and as you all know, the federal government unfortunately fought this case on legal technicalities for 9 years, which I think is important for us to realize is half of a childhood of a generation of children. But on January 26th of this year, the Canadian Human Rights Tribunal made two significant findings. Number one, that the federal government is racially discriminating against 163,000 children. And I think we need to let that sink in for a moment, because there's lots of issues that will come before this table. But I would argue there is none more important than ceasing the racial discrimination against 163,000 little kids on reserve. The second is that, yes, Canada's failure to implement Jordan's principle was racially discriminatory and unlawful. The tribunal noted in its decision that Canada, yes, indeed, knew better, had the opportunity to do better, and failed to do it repeatedly throughout history, and that failure was resulting in the unbelievable removals of First Nations children. In fact, we have evidence that between 1989 and 2012, First Nations children spent over 66 million nights in foster care, or 167,000 years of childhood. And many of those nights could have been spent at home had these children not been racially discriminated against. The others is that this disadvantage was broadening the disadvantage of residential schools. The tribunal makes specific note that Canada's current and ongoing racial discrimination is deepening the harm, not narrowing the harm. And it immediately issued 2 orders. One is that Canada is to cease its discriminatory funding for child and family services and to immediately implement Jordan's Principle across all government services, across all types of jurisdictional disputes, ensuring First Nations children have equitable access. Now, there's lots of talk at this table about the necessity of, for example, of accessing mental health services for First Nations children, but I want to talk first about the burden that the federal government's racial discrimination itself places on the safety and well-being of children. We saw in evidence before the tribunal that the senior level federal government documents acknowledging that they also inequitably fund education, they inequitably fund social assistance, basics like water and housing, on top of the known inequalities in child welfare. The federal government's own document said that this creates circumstances that are dire. This woefully inadequate funding was putting children at high risk for death. And that multiplier effect of those inequalities gets in the way of children being able to live the lives that they wish to have. And in fact, we know from a great study in the United States called the Adverse Children's Experiences Study that the more multiple barriers of experience, the more disadvantaged children experience, particularly in early childhood, the less able they are going to be able to live a healthy and happy life throughout their entire existence. It actually predicts things like coronary disease into your 60s, the ways that you're treated as a child. The other thing that's important for us to think about is the access on children themselves, in that we saw repeated denials of services. And to give you an example, the Ontario Child Welfare Act requires that mental health services be provided as part of the statutory requirements. But the funding agreement between Ontario and between the federal government for child and family services has not been updated since 1978, meaning those children on reserve were not getting reimbursed for these services that came in later versions of the statute. That meant that First Nations children, according to the federal government's own witness, were denied these services, that Ontario was not picking those services up, and therefore the most needy of children, the ones who are continuing to be disadvantaged by this ongoing racial discrimination, had no access to the very services that were intended to remediate it. We all know that the budget, the tribunal is a binding order. I think that's important for us to keep in mind. This isn't another program where the government has discretion. It's under a binding order. The federal government welcomed the decision and chose not to judicially review it. Since the decision, the federal government made a budget announcement which it has pre-profiled in later submissions as being its immediate relief measures. It has announced $71 million for child welfare for this year, rising to $99 million next year. But the full budget for child welfare, 50% of that is reserved for years 4 and 5. Now I want to talk about that incremental approach, in that children's childhoods are not incremental. And these discrimination orders are not to reduce the discrimination over 5 years, it's to end it immediately. So it's vital that that be done. The other reason that I feel that the $71 million is inadequate is our own calculations at the Caring Society suggest that $216 million plus is needed. But even if we were to rely on the federal government's own conservative estimates, which by evidence before the tribunal are inadequate, a federal government document said as of 2012, at least $108.1 million was needed. And that number should have gone up, adjusted for inflation. There's no explanation as to when it went down. Further submissions by the federal government to the tribunal suggest that, in fact, that $71 million is not all going to children and families. Only $60 million of it is going to children and families. About $10.5 million of it is going internally for the department's own costs. And to give you a case study of what that means, in that same 2012 PowerPoint document where the $108.1 million is cited, it suggests that a minimum of $21 million is needed for the region of British Columbia. But the federal government's own estimates say that they're only going to be providing $5.3 million this year. So that's about 25% of what was needed in 2012, and that number will only rise to $14.3 million after 4 years. Think about this. This is a child who's been a baby, who's now just getting ready to go into preschool. and they are only getting 67% of what the federal government projected as being necessary in 2012. Another issue is program transfers. We welcome the federal government's announcements on water, housing, and fire protection. But we're also concerned because we have seen on the record that the federal government has been transferring $98 million per annum out of infrastructure to offset its underfunding of education, social assistance, and child welfare. One PowerPoint that we've seen at the senior federal level says that amounted to $500 million. So if those funds continue to be transferred, then we're going to see those deficits, those schools not being built, the housing and the water not being allocated as it should be. So what are my recommendations? Number one, that the federal government must comply fully with the Canadian Human Rights Tribunal's order. We have issued a submission to the tribunal dated yesterday that spells out the significant shortfalls we have found in the federal government's compliance with that. Number two, that we reject across all children's programs any concepts of incremental equality. No other child in this country has to be told no for 5 years and strive for equal treatment. And number three, that we appoint an independent process to oversee and audit all First Nations programs to identify areas of other inequality and to move swiftly as part of a Marshall Plan to redress those. And another thing is that we need to do is ensure full implementation of Jordan's Principle. That principle was passed, it's never been fully implemented, and up until today, children are being denied services. So thank you, committee members. I welcome your questions.
Thank you very much for your testimony, Ms. Blackstock. We'll go into a round of 7-minute questions, and the first question is coming from Mike Pasio, please.
Wow. Where do I start? I guess I'm going to start with where I have many times with witnesses that have come up, and that is with the funding model itself. And the reason why is because I look at these contribution agreements, and I look at the grants, and I look at the programs, and there's no long-term sustainable funding in any of them. There is no self-determination in that funding. And I wonder if you could speak to that in and of itself, right? What do we need to change from a funding standpoint, from a funding model standpoint, that will give, that will enable and ensure that Indigenous peoples and First Nations and the reserves and et cetera, are the ones setting the priorities for their communities, rather than the paternalism that exists today of the federal government saying, okay, well, we're going to give you this money for this area and this money for that area and that money for another area.
Right, and that's the unfortunate part of this arrival of the federal government at the $71 million figure, is that figure was developed by the government without any consultation with First Nations or with experts that know these funding formulas. So we don't know where that number comes from. So that's an example of that. In my view, there needs to be guarantees of adequate levels of funding that's flexible and needs-based to the actual community and the context of that community. Thankfully, in Child Welfare Member, we have a whole series of recommendations that have been jointly agreed to by the federal government over the years in these studies about how to improve child welfare. The Caring Society, being proactive in this area, revisited all those recommendations and sent them to the federal government in January, the ones that could be acted upon. Again, these were evidence-based, agreed to by the federal government, still had currency, and could address the needs of children, but those were never acted upon. So unfortunately, we're still waiting.
So, and I look at, even your recommendations of appointing this independent process. So just as we have an environment commissioner that looks at the environmental processes and policies that exist within government and does an audit on those, your view is that if we, and that kind of fits into this whole funding formula that I'm talking about as well, is if we have a commissioner of Indigenous Affairs look at the funding mechanisms as they exist today and the shortage as we know, and yes, our government is trying to make up for those shortages with some huge investment that has never happened before, but recognizing that it's going to take a lot more for us to get to a level that is of adequacy. What would you see this as a role that will once again fall under the Auditor General, and once again feeding into that whole funding formula? Do you see that we need to what comes first, the chicken or the egg? Do you
But the binding order comes first, and we already have on the record the federal government's own document showing that shortfall, and the current actions falling far short of that. You know, I hear the arguments in favor of an incremental approach, and at some level I'm sympathetic because we've arrived at this point via 148 years of racial discrimination against children. But we need to think about it from the children's perspective. Why would any child be asked to tolerate ongoing racial discrimination when the government knows it's doing it and has the figures to rectify it and is choosing not to take those actions fully to remediate that? I think that's the question and that we have to come to terms with. I've said to parliamentarians, I appreciate that you have to make hard choices when it comes to budget allocations. You can't do everything. But what are the hard choices that the Government of Canada and Parliament as a whole has made that leave the only choice is to give children an incremental shot at equality? Why isn't it that we can't move boldly and in a leap to redress these known inequalities that are already on the books?
But at the same time, part of the problem we have to recognize is that, yes, we also have pending crisis levels of health care, mental health, that goes across the strata beyond children, of housing, of food security, of you know what I'm saying. So yes, I mean there are recreational facilities, educational facilities. I mean which. Yes, there is 200. Sorry, the number was 216 million that we should dedicate towards the children's services. There's an $8.4 billion investment that is being made there. Once again, it's a record investment. Do we increase that by 260 million, or the difference between the 71 million and the 216 million, and take from another area, or do we take? You know what I'm saying? Like, I agree, we don't want to shortchange it, but if you shortchange clean water, and if you shortchange education, if you shortchange housing, if you shortchange health care, somebody is going to suffer. I mean, children are going to suffer.
I don't think those are the only choices on the governmental menu. I look at things that are discretionary costs in the overall budget, for example. I know there's discussions about sponsoring Expo. I personally don't want to go to an Expo if it means that a child is being denied an equal opportunity to grow up with their families. And we need to be mindful. Although you're juggling priorities, the federal government is under a legally binding order to rectify racial discrimination against children in this case. It is not a question of balancing priorities, it's a question of legal compliance. And that's what we're asking for. The federal government has said it accepts the decision, I welcome that. But it's not going to be realized until things change for children on the ground.
1 minute, Mike.
Yeah, I mean, I'm with you. It's hard to argue against that, especially when it comes to children, and especially when it comes to the historical nature that we're dealing with here. But I'm also looking for long-term answers. And I'm not saying incremental answers. I'm looking for long-term answers from a funding standpoint. And I looked at individuals like yourself that have taken one area completely apart and been able to look at it and say, okay, this is the level of funding we need for it. This is the same sort of exercise we need to go through in every aspect of Indigenous life to bring equality to the rest of what Canadians receive today. And I guess I'm looking to individuals like yourself to help us to work through that process to determine, okay, what are those levels we need to achieve and how do we get there?
I would say that you need that Marshall Plan, that Marshall audit with full participation of First Nations as part of that. You need to look at the recommendations that are already on the books and the documentations of the shortfalls that are already on the books, and develop a public reporting mechanism for those types of costs. The Auditor General has laid a good roadmap. I think the previous Auditor General would also be a great support.
Thank you both. Next question is from Kathy McLeod, please.
Thank you, Mr. Chair, and thank you for your presentation. You clearly sort of articulated your perspective on the financial sort of gap and shortfall. So I think I'd like to head into an area of, I'm trying to, it's a complicated world and it's a world that you've lived in for a long time. It's a huge patchwork across the country, I guess, in terms of models and structures and who's doing what. Is there some, I know in the riding that I represent, there's concerns in terms of it's not working the way it should be. Have you, first of all, got some examples of, not related to the funding issue, but have you put out recommendations around models, or is it very much a grassroots community-to-community process? Could you talk a little bit about that piece?
What we know from the evidence is we've worked quite a bit at the Caring Society on what works. And what works is community-developed programs around family safety. And we have a program called the Touchstones of Hope. And that allows, one of the biggest things taken from First Nations communities through the residential schools and arguably through the ongoing racial discrimination of removal of children today, is the collective vision of what a healthy child is. There are pieces of that. People have kept that. But that collectively held vision in many cases has been disrupted. Touchstones of Hope allows people to reclaim that and develop community-based plans that are not just good for child welfare, but provide a benchmark for community and culturally based wellness throughout the life cycle. That's been proven effective in northern BC. It was evaluated independently by the University of Toronto. And we see examples all over the world where communities are the decision makers and around what's best for kids. That's when kids do better. We actually suggested to the government that $75,000 be made available to each First Nations agency to begin reclaiming those cultural visions as part of the remediation for the tribunal decision. But the federal government has chosen not to implement that for this year. So I find that concerning because I think that really is the baseline for ongoing success, that and flexible and sufficient funding levels over a longer period of time.
So to what degree would that be part of the enhanced prevention focused approach, or is that a separate kind of initiative outside of that?
I think it definitely could be part of anything that you want to call an enhanced focused approach, but I think we need to be mindful, member, that the Canadian Human Rights Tribunal found the enhanced focused approach to be racially discriminatory. So we certainly don't want to be replicating that model or bonding that model. The tribunal says in bold letters underlined, it's looking for reform of the program. And it sets out a three-phase way of doing that. Immediate relief, which is what I was talking about, that $216 million in the door to support what we know are the shortcomings across the 4 different funding models of the federal government. Number 2, medium-term relief, which would be things around restoring these cultural visions, and long-term reform, which will require also internal reform in the federal government itself, so that it no longer replicates a pattern of knowing better and not doing better. It has to build capacity so that it is in a better relationship with First Nations and First Nations agencies and First Nations children. And so that is the process the tribunal puts out. I support that process.
Okay. You mentioned Northern British Columbia, completely different sort of setup. I mean, how much complication is it in terms of all the different provincial and territorial rules and how that works from community to community and the adaptation and the agreements?
Well, what we do know is that there's experts on the ground level who are delivering those services in those complicated environments. What they've been asking us for is to ensure that the federal government, which is really what you're able to exercise and leverage, supports their community-based solutions and funds them adequately, and that has consistently gotten in the way. And as the other member noted too, just those one-year contribution agreements, right? Trying to plan the lives of children 1 year at a time doesn't make any sense in any governing body. And so longer-term solutions over multi-year agreements, those types of things would go a long way to supporting progress on the ground.
Certainly, for me, multi-year agreements is something that it drives me crazy when people are having to give up lease space and don't have that consistency of funding. And I just look at the friendship centers who are now 3 months into a fiscal year with no money. And so certainly, it doesn't seem like there's a nimbleness within, at times we don't have the nimbleness federally, and we need to allow that nimbleness, I guess, to be at a community level. So.
And we also need to, though, embrace the reality that the federal government has been oiled as a machine to racially discriminate against children for 148 years. So how do we change that culture to support people to act in ways that are non-discriminatory? And the Assembly of First Nations, in their submissions towards the tribunal, offer a number of very helpful solutions. For example, training all employees on the Truth and Reconciliation Commission, the history of child welfare funding, the Canadian Human Rights Tribunal decision, and on Jordan's Principle. The federal government has said it will discuss training of its employees, but it refuses to commit to training of its employees.
So where are we at in terms of more appropriately implementing Jordan's Principle?
We have submitted the Canadian Human Rights Tribunal on April 24th issued an order to the federal government saying that its progress in implementing Jordan's Principle was not meeting the order. It required it to do so by May 10th and to confirm that that was done. It did issue a compliance report. We feel it's insufficient. We've issued a request for the tribunal to issue further orders. That will be under a mini hearing will be held by the tribunal on June 23rd and 24th to make that determination.
What do you feel that needs to be done to make Jordan's Principle fully implemented?
There needs to be funding allocated in the budget in order to make it realize it. The federal government needs to be able to embrace the full and proper definition of Jordan's Principle. And also on the federal government's website, it has contact numbers you're supposed to call to report a Jordan's Principle case. My staff contacted all those contact numbers and was not able to reach one person who could receive a Jordan's Principle call. In fact, some of those numbers were out of order. So we've advised the department that even at the front end, they need to address those issues so that families and the public can present those matters.
Thank you.
Thank you for that. Next question is from Charlie Angus, please.
Thank you, Mr. Chair. Thank you, Ms. Cindy Blackstock, for being here. This is a really important discussion. What I find astounding is that Canada was found to be racially discriminating against children. There was a compliance order that they ignored, and that's why you are here today, because the supplemental estimates showed that the Government of Canada decided that they didn't have to bother putting any money into Jordan's Principle. That's why you are here as a witness. You talk about the repeated denials of service that were found of a systemic racial discrimination. I hear from officials, well, it's complicated, we have to consult, we're doing our best. This past week, a little boy was denied an audiology test by a bureaucrat in Ottawa who told the doctor, let's wait till that child's 4 or 6 and see if a problem develops. For a father of a deaf child, I know that if they don't get that diagnosis immediately, that child is done for life. I'd like you to comment on this attitude that we hear from the officials that, well, we will implement Jordan's Principle by consulting. Are they still racially discriminating? Are they still denying service to children in this day?
Yes, they are. In my view, they are continuing to racially discriminate, and children are continuing to be denied services. And that's the uncomfortable reality we need to deal with, is it's not announcements, it's not nice statements by me or by the government or by anything else that changes that reality for children on the ground. It's real change in federal government policy and funding levels that will ensure that children like that, and I hear many stories all over the country, where children like that are not being denied services and indeed set up for a life of disadvantage because we don't have the courage as a country to stop racially discriminating against children as fiscal policy.
Well, thank you for that. And I just want to be clear, I'm not targeting any individual bureaucrat. They are following the policy. The policy of Canada tells them that they have the right to interfere with a doctor's decision about what is medically safe for a child, and that's continuing. So they're still not in compliance. I notice with these supplemental estimates that no money for services have started to flow. That means money for education will start after the beginning of the school year's already started, that there was $0 for Jordan's Principle. How can we implement Jordan's Principle to protect children like the child I mentioned if there's $0 set aside? This government had 12 years, the Government of Canada had 12 years to prepare for the Jordan's Principle settlement. What do you see when you see $0 for Jordan's Principle?
I see children being racially discriminated against. And I do think it's important to recognize that this case did not sneak up on the federal government. Jordan's Principle didn't sneak up on the federal government. Jordan's Principle was first mentioned in a joint report that was agreed to by the federal government in 2005. It passed the House of Commons in 2007. There's been repeated reports by the Auditor General and others raising the alarm about the lack of implementation. And yet here we still find ourselves 11 years later, a whole childhood later, many tragic stories later, still talking about implementing it, and that's not good enough.
So when the government responded with their budget and they put in $71 million for the child welfare needs, when it's been estimated that it's over $200 million right now, What we were told by officials at this table just over a week ago, that they would love to help. They would love to meet that, but you know, it's an issue of capacity on the ground, and it's going to take a while before we can get capacity on the ground. So my read of that is they're saying that all the child welfare agencies that have been starved of funds over the years are somehow not capable of meeting the needs of the children, and the government wants to work with them. What do you see when you hear that they say it's an issue of capacity, that even 5 years down the road they still will not be in compliance with respecting this Human Rights Tribunal?
There was no evidence tendered at the Canadian Human Rights Tribunal by the federal government that the reason why children should be treated unequally is somehow a capacity issue of First Nations. There is no finding in the Canadian Human Rights Tribunal that suggests that First Nations are somehow incapable of addressing and providing equitable services. The capacity issues that are mentioned in the tribunal's decision all deal with the federal government's failure to act on previous solutions. And I think we need to really think about this. I talked about this in our submissions yesterday, that the federal government, in suggesting it's a capacity issue and providing no evidence how it knows that all 100 plus First Nations agencies, many who have been operating for 20 to 30 years and have won international awards for their practice, are somehow all incapable of addressing and implementing services that would comply with the order as of right now. I think that's akin to really saying that we can't treat you equally because you're not capable. And if this was a gender or pay equity issue, I don't think anyone would get away with saying that women aren't worthy of being treated equally today. They don't know how to spend the money. And that's the type of argument that we're seeing there, and with all due respect to those who are making it.
So we saw, you were part of the pre-budget consultations. You laid out the issues that needed to be done. They were ignored in the budget. The Human Rights Tribunal came down. We had the supplemental A's, which is this is the opportunity for the government to meet the compliance. There was $0 for Jordan's Principle, $0 to meet the child welfare shortfall. So is it, I'm not a lawyer, but we're dealing with a legal ruling about racial discrimination, and what we hear from government as well, it'll take 5 years to get our act together. Do they risk being in contempt of court for denying, refusing to meet their legal obligations?
Yes. Yes, they are at risk of that. And in fact, we've seen from the tribunal that subsequent order from May 24th that said the progress was insufficient and they were ordered to immediately report back.
Thank you. I just want to close on the issue of this shell game that happens when Indigenous Affairs has to start playing catch-up and they start hauling money out of projects. We've had schools canceled in our region. We had water plants canceled. So the numbers we're getting, you suggest about $98 million a year, $100 million a year. Without a legislative framework, the government's saying they're not going to do any legislative framework on education. They're just going to flow the money out the door. We don't know if the money will ever actually go out the door or how much will go out. But if these shortfalls continue to exist, are we going to still see this shell game of money being pulled off very important needs to start meeting shortfalls because they didn't put the money into child welfare in the first place?
Yes, and the Auditor General actually recommended they cease that process in 2008. The federal government agreed and continued it. What it would represent is if that $98 million in transfers continues, for example, that would represent 52% of the planned education infrastructure funding that the federal government announced in budget 2016. Those facilities would not be built.
Okay, thank you very much. Thank you.
Thank you. Next question from Gary Anandasangri, please.
Thank you, Mr. Chair. Thank you, Dr. Blackstock, for being here and for your continued and very effective advocacy on this issue. A couple of things I want to probe. I want to start by a quote that you had, to quote you from an article called "Reconciliation Means Not Saying Sorry Twice." And you say reconciliation is not just about saying sorry, it is about understanding the harm in a way that not only acknowledges the past, but also leads to new awareness and commitment to avoid repeating the same mistakes in the future. Reconciliation requires not just saying the right thing, but also doing the right thing. Just reflecting on that, can you highlight maybe some of the current issues? And we recognize the issue in the child welfare system. I think that's quite clear with the decision. What are some of the other issues that will probably give light to some of the challenges that we face today, and maybe 2 or 3 issues that the government needs to address immediately?
I think the shortfall in education is certainly a key one. I know there's investments, but again, they fall into the same peril as the child welfare. They're rolled out over 5 years. 50% of the investment doesn't come until year 5. So if you're a kid in grade 8, you won't see the full benefit from those. And we know I have a report in my office. I kind of like to collect old documents. And it was commissioned by the Department of Indian Affairs for the Education of Children in Ontario. It's written by a man named Alex A. Sims. And at the time, he recommends reforms in education, including First Nations control over education, equity in education, making sure there's appropriate curriculum on Aboriginal peoples in the curriculum. And he writes this paragraph, and he says, can anyone hazard a guess as to what year or what century real equality will happen for Indian children? That was written in 1967. I was 3 years old. I was one of those kids that recommendation could have helped. And we're still at it. Those recommendations are still on the table, and I'm 51 years old. I talk to First Nation students who are going to these underfunded schools, and it is so painful to talk to them because I remember meeting Chelsea Edwards from Attawapiskat First Nation. She took over this as being spokesperson for the Shannon's Dream, the Safe and Comfy Schools and Equitable Education campaign. And she was about 15 years old, and she said to me, Cindy, it's too late for my childhood. It's too late for me to be treated equally. But it's not too late for a baby born today. Maybe we can do something for that baby. And that's why we can't get addicted to this concept of incremental equality. It never comes. And children don't have incremental childhoods. So even though it may make sense at a government level to flow things over 5 years, it wouldn't make sense if you were that child in that school or the parent of a child who's not being given the same opportunity to succeed. There would be no way that you would tolerate it. There's no way that you should tolerate it. And yet we have become comfortable with this in Canadian society. So that needs to be addressed immediately. The others are the reality that many First Nations live in third world countries. And I hear this rhetoric over the years that, well, we can't get clean water up to some of these communities. But if we can get a Twitter feed to a guy in space, surely we can get clean water pumping into Aganega First Nation an hour and a half outside of Toronto. These are things that we can do if we're motivated to do them. And I don't think there's any excuse for one of the 11th wealthiest nations in the world to not be providing clean drinking water to every citizen in the country. The final thing is to remind ourselves that we aren't doing our best job for all of Canada's children. There's an international ranking called the Child Rights Index. It looks at how well countries are doing in proportionate to their wealth to their nation's children. Last year, Canada ranked 57th in the world. That leaves a lot of room for improvement for one of the wealthiest countries. We need to, as parliamentarians, I encourage you to much more often put children on the agenda, because the economy is doing better than children because you talk about it more and you pay a lot more attention to it. But the real reason for an economy is to make sure that children are benefiting and that we're creating a sustainable society, and that means paying attention to kids.
Thank you. Now, you discussed a Marshall Plan type of execution of these programs. With respect to child welfare, what would that Marshall Plan look like?
We have proposed that in our submissions to the tribunal. We want to be solution involvers. I'm not about winning. I want to make sure things change for kids. Number one, we have said you need to provide, update that $108 million to 2016 values, get that flowing out the door, full compliance with Jordan's principle, ensuring that you're making investments that address remoteness and immediate factors. The second piece is those investments in culturally based plans, so that we know what culturally based services are and how much they'll cost. And then we also look to some of those structural issues around the funding mechanisms, the things the Auditor General has identified for us for year after year as long-term solutions. So we see it as a three-stage thing. We'd be happy to send you the submissions that we've made with regard to these solutions so that you could further consider them. And I do have a written submission that'll get translated into French, so it's available to you as well.
Now, I want to probe on something that's a little bit out of the scope of your discussion, but is very relevant to it, which is the racialized statistics that I know Ontario has now adopted with respect to child welfare. Is that something that is now across the board in all the provinces? And if not, what do we need to do to get those numbers available across the board?
Well, there is in the United States a national child welfare data collection system. Canada doesn't have one. In fact, I can't sit here and tell you even how many children are in child welfare care today. That's something I'd encourage the federal government to look at, is national data collection system, so that we are able to get a better pulse on what's actually happening to children, not only in child welfare, but in other areas of their experience, and to launch longitudinal studies so that we can see what's actually happening to these kids across their lifespan.
In fact, just our last session, we had, I believe, Professor Harris talk about suicides, and that's one of the challenges, is to be able to have race-based statistics. Now, why do you think that hesitation exists?
Gary, I'm afraid we're out of time, so I'll launch into a third question there. Okay.
Thank you.
Thanks. We're moving into the 5-minute questions, and the next question comes from David Yurdiga, please.
Well, thank you, Mr. Chair, and I'd like to thank the witnesses for being here today. I mean, this is very important that we're having this discussion, because our children are our future. So what we do now will determine how successful they will be in the future. So thank you for being here. It's really important. You know, what are the challenges in providing child and family services in northern communities? You know, a lot of the northern communities are isolated. It's very difficult to get professionals up into those locations. So what is the solution to address the most northern communities?
Well, we've seen good practices from various First Nations agencies. In the research that we've done and in our consultations, one of the concerns actually has been the underfunding. So it's difficult for even agencies in urban area or First Nations proximal to urban areas to recruit qualified staff, because just across the road as a provincial worker, they can make a lot more money. And so one of them is actually ensuring that there's sufficient funds to recruit and retain people in northern communities. The second is that we need to look at some of the technologies that are available in order to provide services. We have made advancements, for example, in telehealth, but there's no capacity on the child welfare side to replicate programs like that, so that those types of services could be available to children in remote communities. The other thing is that we need to take full advantage of addressing some of the multiple inequities. So if you have communities, we know this from the research, if you have communities where there is no water, where there is no sanitation, where there is no roads, those issues of remediating those concerns will reduce the child welfare factors. And so that takes investment. And we can do it. If we can build a building platform in the middle of the Atlantic Ocean to drill oil, surely we can provide infrastructure in northern communities so that children can get clean water to drink. All those things would help.
Okay, thank you. Is there any programs out there that actually promotes people from the community to undertake becoming a professional to address? So, you know, instead of bringing people in, we train people within the community. Is there any such program to encourage our youth to go into this field?
Yeah. Just circling back to your last question, I just make a note that in the United States, it also has remote communities in Alaska. There's no boil water advisories in any of their communities. So if they can do it, we can do it too. To your question on First Nations children and reaching this profession, one of the things that you need in order to be a social worker is a successful transition from elementary and secondary school. And what we know is the underfunding of elementary and secondary school means that First Nations children are less apt to graduate, less apt to be successful in post-secondary. So we need to redress those issues. And then absolutely, we've seen innovations in the delivery of post-secondary. I work at the University of Alberta, and developing online programs for social workers has been found to be very successful. Doing post-baccalaureate programs that are a combination of both online and in session, both at universities and in joint training programs that are Aboriginal-based, have also been proven successful.
You know, I come from a business background, and, you know, I like to go in there and fix things. I mean, if it needs to replace, you replace it, because long term, it is actually more economical. But it seems that the bandage approach has always been taken, you know. So investments that are currently required, and obviously it's water, it's wastewater, it's housing. And I know it's an immense undertaking for government. What would your two most priorities to address first? Obviously, we can't address everything at once, but what are the two top ones that you would say we should proceed?
I would like to see this Parliament make a decision that you're no longer going to racially discriminate against children as fiscal policy going forward. Number one, you stop doing it. You stop deepening that hole of disadvantage. And that's across all areas of their experience. And number two, that you start addressing creating that Marshall Plan to address the shortfalls that have been accumulated over this last 148 years. But that first decision is you stop the racial discrimination starting today. In my view, member, that would be the greatest gift to Canada's 150th birthday, because as a nation, we're better than racial discrimination against kids, and it would bring us into alignment with those values that Canadians sing when they say they stand on guard.
Okay, thank you. How much time I have left?
That's it. Thank you.
Really?
Yeah. Well, 4 seconds.
4 seconds. Thank you.
Thank you. Next question is from Michael McLeod, please.
Thank you for coming to present to us some very shocking statistics, and thank to our Grand Chief from Northwest Territories for joining us. Appreciate seeing him here. I'm looking at the numbers that you've put out there in terms of what's needed to start to address some of the issues for the children, and the $260 million that you identified as what we should be looking at. And I'm wondering how broad does that cover? Does that cover all Aboriginal, Indigenous populations, or are we just talking the First Nations? You're not including the Métis and the Inuit in this, are you?
No, I was speaking with regard to the immediate relief measures arising out of the Canadian Human Rights Tribunal that only affects First Nations children and within the provision of Child and Family Services, and to take a start at the provision of Jordan's Principle. So that doesn't even cover what's really needed for First Nations children in child welfare.
Okay, that leads me to my next question. Then you've talked and you carved out an area for BC, but have you carved out an area, or have you looked at what's happening in the Northwest Territories? Because if you're talking First Nations, and a lot of what's in the budget is identified for reserve. Now, we don't have reserves in Northwest Territories. We have Aboriginal people that live in communities, and I'm just wondering if this takes that in consideration.
The actual program for INAC's provision of Child and Family Services does not apply to the territories, but I had the honor of being on an advisory panel and visiting many of the First Nations communities in the Northwest Territories regarding legislative change, and I can see many of the same deficits being played out there for children. Those solutions should not be confined to a borderline of a territory. Those communities have been asking for the same types of opportunities to safely raise their kids as everyone else. And so I would encourage the territory and the federal government to ensure that the needs of those children and families are provided for. And of course, you have the regional chief right here who can give you more specifics on what those answers have been and have been propositioned to the government for many years.
Yeah, thank you. Exactly what I wanted you to say. We've heard from many witnesses over the last while, and as we talk about the issue of suicide, there's a lot of shocking information coming forward, and we've heard from Mr. Jack Hicks, who specialized or has done a lot of studies on suicide, and he's identified a lot of issues that need to be tackled. And we had the leader of the ITK also talk about the environment in which children grow up and how it impacts them later in life. And we know in the north that we have no specialists. We don't have doctors that are visiting our communities consistently. You're lucky if you see the same doctor twice in your lifetime. Most nurses are locums, so we're probably challenged even more than the southern jurisdictions. And we also have housing issues. We have issues with addictions. We need counseling. We need jobs. All these things are issues that need to be addressed. So I was really glad when you mentioned that this government and governments, whether they're territorial or provincial or federal, need to learn more about our people. And in our case, they need to learn more about what it's like to live in the north and the challenges we have in areas of cost and isolation. We also heard from corrections that talked about the correction system being our new residential school problem, and where we are churning out, or we're not churning out, we're locking up so many people that need assistance. And I can vouch for the fact when I campaigned that the elders are very concerned about child apprehension.
1 minute, Mike.
So has there been any work in costing of what it's overall going to take to solve some of these issues?
Not as a Marshall Plan, but what we do know is what it will cost you if you don't do anything or you continue to do this drop-in-a-bucket approach. The World Health Organization says that for every dollar a government spends on a child, you will save $20 US down the line. Fail to spend that dollar, and you will be spending $20 down the line on corrections, mental health, and addictions programs. It goes back to what Frederick Douglass said back in the 1800s. You raise a healthy child, it's cheaper than fixing a broken man. It's been true then, it's still true now.
Thank you.
Thank you. Next question from Arnold Gerson, please.
Mr. Chair, and thank you to Ms. Blackstock for being here today. Really appreciate it. Just a couple of things that I was hoping. First of all, when you say Marshall Plan, could you just clarify that for me, what that term means?
When I use that term, I'm talking about too often the approach by Parliament in the past has been to look at issues one at a time. Youth suicide, the deficits in child welfare, maybe looking at housing or water. What we haven't done yet is looked at the causal factors that tie all of those things together, which is, in my view, the inequities, the lack of recognition and support for community-based solutions, and the lack of capacity in the federal government. I think those are the types of things we need as a Marshall Plan to address all these inequalities across all areas of experience.
Okay, thank you. You talked about, you made the point that we can drill for oil offshore, but we can't bring water to our First Nation communities. One of the things, though, that's a complete difference is that we're drilling for oil offshore. That's a private enterprise deal. Bringing water to First Nations is entirely the federal government's responsibility. There's other areas of life where, when it's entirely a federal government responsibility, we have complete failure in other areas as well, not only bringing water to First Nations, but also in my own province of Alberta, we have caribou, and in the only two herds that have disappeared have been in Jasper and in Banff, both areas where it's entirely federal government jurisdiction. Have you looked at maybe is there any like private industry that has the capability of bringing in some of these things that you have, having it like an alternate model? For example, one of the interesting things that I think about is in Airdrie, Alberta, they have significant hail issue. Now you think there's nothing we can do about hail. However, the insurance industry, which is a private enterprise, they actually seed the clouds to make the hail smaller, which is something that I had no idea. There may be like a private recipe for success in some of these instances. Is that been on your radar at all?
Member, you raise an important point. I used to work off reserve in one of the richest municipalities in Canada, the West Vancouver in the British properties, doing child protection. Never once was I asked for those people, as rich as they were, to seek out private subsidies for their delivery of child welfare. There are some services in this country we have declared as being a public good, and First Nations should not be required to get private subsidies for services that are a public good for everybody else. That in itself would be discriminatory, and I'm sure not something you would support. The other piece that's important to look at is that the Royal Commission on Aboriginal Peoples is reaching its 20th year anniversary this year. And it was the beginnings of that Marshall Plan we talked about. It has never been implemented, and it included supporting First Nations so that we could walk away from the Indian Act. We'd have sustainable economic, social, and spiritual and social infrastructure. And I think I commend that report to you because I feel that a lot of those same recommendations are available today. Had they been implemented, we might be not having this conversation today.
For sure. When it comes to like education, for example, in the province of Alberta, we had one of the best education systems in the world, and that was because we had a vast array of different types of education. Clearly, what we're doing right now is not working. Asking the federal government to spend more money on all of these things is the easiest answer, but it hasn't worked in the past, and I'm not sure if that's going to spending more and more money is going to be the solution into the future.
All due respect, there's never been a time when First Nations children have received an education equitable to what other Canadians have received. That's never been tried. And I'd like to see it. We know from the work of the Martin Aboriginal Initiative that brought 2 schools up to par for equitable funding, that those kids went from very low rates of literacy to exceeding the rates of literacy for non-Aboriginal kids within just a few years. So I think there are demonstrative projects that show that that would work.
For sure. One of my last questions is just the family child, or the First Nations Child and Family Caring Society. Where does your funding come from, the entire society?
It's a good question, because within 30 days of filing this case, the previous government cut all of our funding. So we receive no government funding. It's funded completely by private donors.
Thank you. That's all for my questioning.
Thank you. I'm afraid we're out of time. We'll have to conclude this testimony. I want to thank you very much, Ms. Blackstock, for joining us, and Mr. Erasmus for joining us today. Your testimony will be most useful as we continue to deliberate on the supplementary estimates. Thank you so much for your time. We'll have a short suspend for about 2 minutes, and we'll recommence. Thank you. back to order, please. And I'm going to invite committee members and those in the room to turn their minds from supplementary estimates to the different but not at all unrelated issue of the study of suicide among Indigenous peoples and communities. And we're very happy today to welcome Isidore Day, the Regional Chief in Ontario of AFN, to deliver testimony. I think by now, Regional Chief, you know about the cards, so without any delay, the floor is yours. Thank you.
Yes, thank you, Mr. Chair. I'd like to first of all acknowledge the creation, the prayers, and the protocols. Also want to acknowledge the traditional territory of the Algonquin people. I want to acknowledge Cindy Blackstock, who was just the previous presenter, and again, thank her for all her work that she's been undertaking with the Human Rights Tribunal on Child Welfare. I as well want to just note here that I have Ken Young sitting beside me during this presentation as a reminder and recognition of the era of reconciliation. Ken is a Indian residential school survivor. He's a leader in our First Nation communities and somebody who very well knows these issues. And I have him beside me just to help keep me focused on the fact that much of what we're doing is about the modern era of reconciliation and the important work that needs to be done through these committee presentations. I also want to acknowledge the First Nation leadership that were here. I want to acknowledge the committee members. I am presenting here today as the Ontario Regional Chief, a member of the AFN Executive who holds the portfolio for health and the chair of the Chiefs Committee on Health at the AFN. I'm also presenting as a proud member of Serpent River First Nation, and as such, these are not just policy discussions for me. These are quite literally life and death discussions, and decisions must be made here in Ottawa that will profoundly impact the families in communities like mine. But we must always be on guard for the issue of suicide, as we've seen in recent days. The community of Woodstock here in southern Ontario fell victim to a trend of suicide that's really putting the question of suicide in front of all Canadians. Before I proceed with my remarks, let me point out that the current suicide crisis will only end if we have addressed all the social determinants of health. Our communities need clean water, safe and adequate housing, a decent education system, and economically sustainable communities. Once we move from the third world conditions in our communities to mainstream Canada, once our children are no longer living in desperate situations, then this national crisis will end. Simply put, the people sitting around this table can finally recommend that we end Canada's greatest shame, First Nations poverty, despair, and the manifestation of suicide. Some of the roots of the crisis. As you have certainly heard throughout your study work, suicide in First Nation communities is a result of the coming together of many historical, social, political, and economic and environmental factors that collectively make up the social determinants of health. And I want to underscore one thing. I don't want to get into it in depth, but I must underscore the question, the serious nature of climate change, and what that must be doing in terms of the minds of individuals and the collective identity and the feelings that people must feel in the remote north. I believe some of the suicide ideations can be and probably are connected to the issue of climate change. The most profound of these factors is settler colonialism. Colonialism displaced First Nations people from our lands and waters, and thus our sources of identity, spirituality, and economic security. First Nation governance systems were undermined and replaced by foreign systems based on profoundly different worldviews grounded in hierarchy and patriarchy. Our languages were literally beaten out of the children at the residential schools. Children were stolen from their homes to face physical, sexual, and psychological abuse in these schools. The staggering rates of First Nation children in the child welfare system demonstrate this painful legacy that continues and is eloquently outlined and in great detail by Cindy Blackstock in the previous presentation. First Nation youth face the daily stress of having to face a Canadian society which claims to be built on the principles of fairness, justice, and respect for diversity, while they survive in communities without basic necessities like schools and clean water. And at the same time, The comments sections on news stories about them are filled with people telling them that they are living high life on the taxpayer dime. With all this in mind, the suicide crisis facing our youth should come to no surprise. In fact, it is entirely expected outcome given what our youth and our communities face every single day. I must point out that the demographic profile of those who attempt or commit suicide is vastly changing. Children and elders in their twilight years are simply not the norm, but becoming increasingly evident as part of the statistic of suicide in First Nations. A 10-year-old boy in the Anishinaabe Nation territory and an elder in the Treaty 3 region are just two examples that I would cite where the culminating issues had to do with the lack of primary health and mental health services. Point blank, funding cuts to health services in First Nations over the last decade. The question then becomes, what can be done? So moving forward to address suicide, it is imperative to address First Nations social determinants of health, support and advocate for community-based approaches to suicide prevention, which our youth refer to as life promotion, which simply means investing and paying it forward in developing for youth, for their communities. The youth need the decision makers to prioritize in generating hope through strategic investment. We also commend Minister Philpott for meeting with the youth just yesterday. And I just want to quote something that the minister said as it pertains to the meeting. She says, "I'm grateful for this opportunity to speak directly with First Nations youth. And I want to thank the AFN National Youth Council members for bringing their concerns and ideas to the table. Their willingness to talk about their challenges and how we can work together to address them helps me better understand how the Government of Canada can support their well-being. Their support is a critical factor in generating positive long-term change." End of quote. I must first of all commend the youth and the AFN and the Minister for their efforts and the work that will be important coming from the roundtable. At the same time, I want three things in relation to Minister Philpott's words. The first thing I'd like to see is we need action now, and defined, budgeted, and collaborative. The second thing is we need the Minister to ensure that medium and long-term planning and health accord negotiations must formally include our youth as part of that process. Thirdly, we need the Minister to work with the youth of the AFN to formalize life promotion as more than just ideology. We need to build strategic investments that work towards the diminishment of suicide through programs aimed at moving from the current national suicide crisis in our youth populations to a greater focus of strengthening a new generation of young people who are empowered to want life over death. Of course, their lives must be seen as worthy, worth living, and worth the effort of strategic investments of this government. Full implementation of the First Nations Mental Wellness Continuum framework and the full demographic and added element of youth in life promotion strategies. The framework outlines opportunities to build on community strengths and control of resources in order to improve existing mental wellness programs for First Nation communities. This includes community development, as indicated by the previous speaker, quality care system and competent service delivery, collaboration with partners, enhanced flexible funding, and ensuring culture is at the center of the mental wellness continuing framework. The full implementation means increasing the amount of flexibility of resources in order to increase capacity, to ensure quality care systems and competent care delivery so that all First Nations have access to the essential basket of services that make up the continuum of care. On the social determinants of health, as mentioned previously, health outcomes cannot be addressed by the healthcare system's interventions alone. What is required is a real and substantial investment in the social determinants of health, including adequate and safe infrastructure, culturally relevant education, a reformed child welfare system, and economic opportunities, among other things. In addition, research demonstrates that self-determination and cultural continuity acts as an important hedge against youth suicide. Therefore, community self-determination support the cultural activities and support for cultural activities are also life promotion activities that are needed. With the commitment to nation-to-nation dealings and investments in the budget 2016, the new government has made an important step in terms of addressing the social determinants of health. But the reality is First Nation youth continue to sit in moldy, overcrowded houses without clean water. Much work needs to be done. They have waited long enough.
One minute, please, Mr. Day.
Support for community-based approaches to suicide prevention. Again, life promotion defined. We need to look at, given the role of self-determination as the hedge against suicide, it is vitally important that support community-based approaches to suicide prevention activities and programming must be implemented. Community development programming, which leads to reduce the risk of suicides, includes skills development and coping skills, job readiness, recreational activities, and decreased isolation and increased peer support for our youth. I just want to read a couple quotes to end my submission here. Thank you for the time, Mr. Chair. So I want to read these quotes because these are things that people have said with respect to the issue of suicide, and this is the things that they want conveyed to this government. And this is a mother. She says, as a mother of a transgendered youth who actively sought out immediate help for a son during a suicide crisis, I quickly found out that there is little to no culturally appropriate resources available to him or his family. Any resources were primarily largely city-centered support systems, leaving us feeling left out of the suicide conversations and even more isolated and alone, which brought him to that place of crisis. We need immediate resources to help support our youth in crisis and help for our families that are at a loss to find that desperately needed outreach support that is lacking in remote and urban First Nation territories. The second quote, which is shorter, says, we are faced with major issues as First Nation people that are about dispossession from our lands and being systematically torn from our families through the residential schools. Canada and the provinces must reconcile and deal with the impacts of the Indian residential school system and the Indian Act system. Until these issues are addressed directly, our people will continue to feel hopelessness. Our people will continue to die of chronic health issues and suicide. And the last one, suicide trends in our First Nations are part of a collective post-trauma. Community healing is needed now, and we cannot wait any longer. Our families need to be a focus in healing, and this will make our communities stronger. So thank you for the time, Mr. Chair. I'll take questions.
Thanks very much, Regional Chief Day. And if you'd be willing to leave your speaking notes behind, that would be most helpful indeed. Thanks.
Absolutely.
We'll move into the 7-minute questions, and the first question comes from Don Resnack, please.
Well, Regional Chief Day, it's good to see you again and see you again before the committee. As you know, I hail from Treaty 3 territory in northwestern Ontario, and we've had suicide crises in that community or in those communities. I know particularly acute problems in NAN communities where I have a lot of interaction with people from NAN communities in the city of Thunder Bay. I've been hearing over the last little while, and indeed over my many varied careers, including with the Grand Council Treaty 3, that one thing the suicide crisis is, it is a crisis that needs an immediate response and not just a Band-Aid response. But money is not the only answer to solve the problem in the communities. It's very important for government to listen to the people that know their communities and know the issues in their communities. So having said that, in your experience now with the Health Minister and the Minister of Indigenous Affairs and their department officials, have you seen discussions regarding community-based solutions coming out of the communities and being communicated to both of the departments that are so intimately involved?
Yes, thank you, Don. And I just want to focus on the caveat that you mentioned about funding not being the only issue. And I want to leave that out in front here because I think it's an important observation. And I liken it to the issue of getting into a vehicle and going somewhere. We obviously know that we can't stay where we're at. We are in a crisis situation. We hear about these public health emergencies. We hear about the attempted and the committing of suicide. So we know we can't stay there. The vehicles that we have, and I leave this with the committee today, we have done all the planning. We have talked quite a bit. So we have the framework necessary to get the work done. So that's what I can tell you. So that part of the discussion doesn't need to happen anymore. We have the tools, we have the framework, we know what needs to be done, we know where we want to go. So we have the vehicle, we have the plan. We need the fiscal fuel in the tank to get this done. That's the issue. We now need strategic investment. We can no longer talk about this issue. We've got the plan, we need the fiscal fuel in the tank, make the investment, let's get moving.
I couldn't agree more that that I know when I was with Grand Council Treaty 3, we had frameworks that weren't funded. But in terms of the long-term solutions, not just dealing with the crisis, and I know it's very important for the work of this committee that not only we hear about dealing with the immediate problems, and we know there's over the last many years there's been funding problems for a lot of our First Nation organizations and organizations that are doing great work. That we need to increase that amount of funding, and certainly there's been a commitment by this government to increase that funding to historic levels. But in terms of long-term solutions, we've heard, and I've heard over the many years, that ultimately it's going to be First Nations that drive these long-term solutions and creating an economy where First Nations make their own destiny. I've spoken to a lot of chiefs in my riding. Chief Leonard from Rainy River First Nations really believes that getting involved in the economy and creating business opportunity and wealth for his community will eventually drive their community forward, and hopefully in the future you won't be seeing a lot of the problems we see now and won't have to be doing crisis management. In terms of what you've seen in Ontario in terms of long-term solutions, or can you give us any long-term solutions so we don't end up in these crisis situations over and over and over again, where the government is essentially reacting to crisis over and over again?
Yes, thank you, Don. I think when we look at long-term solutions, I think through the insight and wisdom of our previous presenter again, Cindy Blackstock, she did mention the Royal Commission on Aboriginal People, right, which is 20 years now. And we're also seeing something that is more recent, and just last year, a year ago, pretty much, we've seen the executive summary of the Truth and Reconciliation 94 calls for action. And if you take those two combined efforts of a commissioned approach to look at the problems and the solutions, we've seen some of the solutions around the Indian Act come out of the Royal Commission on Aboriginal People. But then the people part of it, what happened to our people through the residential schools, the 94 calls for action and the roadmap that's laid out in the Truth and Reconciliation report, I think those two things combined, taking the RCAP piece and taking the TRC 94 calls for action, in there's a plethora of options and alternatives and models for long-term solutions. So I want to say that it's a really big question, but I think that we have now in front of us the action plans, the roadmap, and I think we just need to get it done. And I'll say it again, I underscore the importance of this government coming out and making long-term investment, short-term and long-term investment. The Ontario government recently done that. They made the apology in the Ontario legislature. They just in the last 2 weeks put out $500 million in First Nations in the province of Ontario. We need Canada to move on this.
Thank you. That takes us right to 7. The next question is from David Yerdiga, please.
Well, thank you, Mr. Chair, and I'd like to thank Regional Chief Mr. Day and Mr. Ken Young for participating in our study. It's a very important study, and you know what? Just looking at all the strategies. There's so many strategies out there to address suicide, whether it's youth or adult, young adult, or even the older generation. And has the Assembly of First Nations actually reviewed all these different strategies and looked at what's working and what's not working? Because obviously some communities are doing very well as far as programming goes. You see one community in another community that's just, you know, a two-hour drive. A much different story. So I think we have to look at, so you have any input on far as the strategies goes and what's out there currently?
I think, you know, strategies, strategies and studies from an anthropological approach, you know, they give us information to work with. I think we must underscore the fact that there are also emerging drivers to social issues and conditions, and I would have to suggest that, you know, the culminating factor of inaction by governments to address real injustices, like Cindy Blackstock is talking about child welfare, like we're talking about the Indian residential school issue that has been brewing for a number of years, and we seem to be dealing with the multi-generational issues and impacts. You know, one thing I'm going to keep underscoring is the issue and need for real investment, strategic investment. But I think your point to looking at and possibly doing a meta-analysis of all the studies that are there, as the Chiefs Committee on Health, we certainly believe that as we move into the end game with respect to the health accord, we do want to take health and social policy framework approach, and we do want to be able to deliver you know, some input to the youth's efforts on life promotion. And if we're going to be able to do that responsibly, we do need to have a good take on what the combination of all these studies and all these reports are saying. So this work is in front of us right now, Mr. Speaker, and I just want to let you know that it's something that we will be discussing directly with our youth, but it's also part of the work that the Chiefs Committee on Health are working on as we put forward these types of proposals to the federal government.
You know, the Quebec Suicide Program is claimed to be one of the best in the world. Have you looked at that program? I understand that they decreased the suicide rate by almost 50%. So have you guys looked at that model?
Which one, sir?
It's the Quebec Suicide Prevention Program.
No, I haven't. I apologize. I can't say I have.
You know, it's so important. I think we have to look at everywhere. I mean, you know, and I was told before, every community is unique. So one program may not work for another community because of whether one community has more resources as far as economic opportunities. So there's so many factors, and I don't know if one strategy will fit all communities. So can you comment on that?
Yes, I can, and I'm just gonna take a little bit of a risk here, and I haven't seen the study, but based on the fact that you're making reference to the Quebec region, I would actually feel safe to say, in my assumption, that, you know, perhaps it has to do with the self-government agreements in the north part of Quebec and the James Bay Cree Naskapi Commission, and the ability that they have to have more control in First Nations jurisdiction of health and social programs, but more importantly, having a direct connection and shared control of lands and resources in the province of Quebec. I would wager to guess, Mr. Speaker, that is one of the main reasons why suicide rates have been reduced by 50%.
Yeah. And regarding these suicide strategies, how important is it to involve cultural elements within that strategy? You know, whether it's you know, cultural healing practices, is that should be one of the biggest components in the strategy?
Yes, and I think that's a close-ended question. If you allow me to elaborate a little bit and give you my reasons why I think that is true, is because oftentimes there's this deception. You know, most people, you know, save and accept that the ones that you know want to have the right to choose to die. I want to make very clear that this is about preventable loss of life, and that our people don't want to die. That there's a deception that says, you know, we definitely want to live. We want a better life. So what is the last part of your question?
Well, I know in some communities that even from some of my family members, they talk about identifying with their culture and how much they want more of it. I mean, obviously, a lot of First Nation, Indigenous people, a lot of them don't live on First Nations anymore. They live in other communities, and there's sort of it seems there's a lack of programs for them. Even in, you know, they may not necessarily be going to a school within their First Nation, but they're going outside of their community to get educated, and there seems to be not enough programming to address their culture.
So let me elaborate then, and I think that's probably one of the biggest factors in the success of the types of programs that are needed, and I just might say that individual that wants life more than anything, our First Nation people will always defer and refer to the issue of their connection to the land, their home, and often our people are facing this question of suicide because of identity issues, and we certainly see that a return back to the language, back to the culture, back to the land, and having that sense of self and connection to land and community and home, that's the biggest factor in success of suicide programs that we see across the board.
11 seconds, David.
Well, thank you to both of you for participating here today.
Thanks. Next question is from Charlie Angus, please.
Thank you, Mr. Chair, and thank you, Chief Day. Good to see you again. Thank you, Mr. Young, for being here. I want to look on two levels. One is at our committee, we are dealing with government and policy, so start there and then maybe go to the ground, what it looks like on the ground. You talked about not having any money in the fiscal tank to get what needs to be done. We visited Kashechewan and Attawapiskat last week with Minister Philpott, where she saw the Tylenol clinics, they call them, where we have no doctors, we don't have the proper medical services, we don't have the mental health workers, but there was $0 in the federal budget to add new money to either health or mental health services for Indigenous communities. What does that shortfall mean? What are you looking at in order to fill that fiscal tank?
Well, what I have today, Mr. Angus, and thank you for the question, is we're looking at the First Nation health crisis and specifically mental health. We feel that mental health should be a shared plan. First Nations are quite prepared to do this work. But as you indicated, one of the shortfalls in the 2016 budget was with respect to mental health and addictions. So what we've got here, Mr. Angus, is we've got a very brief plan, but what we spelled out are the types of investments that are required. You will require in the you will recall in the standing committee that we had on the NAN health emergency. You know, the government was faced with the issue as it's seen in the north. However, across the board, what we need across the country right now is $136 million increased annually to deal with mental health and addictions, and these are investments that should have been in the 2016 budget, but they weren't. So we've been very succinct and very clear about how to break up that investment, and that will be in the supplementary material.
Thank you. That's very helpful. We've been hearing a lot about the First Nations mental wellness continuum framework, but the government's told us at committee that there's only $350,000 in there. What do we need to make sure that we can do that, make full use of that?
Well, again, the overall ask here is $136 million. You know, that broken down across 633 First Nations across the country, you know, it just shows that even at $136 million, you know, it's a pretty conservative estimate. Like, we definitely need a lot more, but this is what we need immediately.
Thank you. Well, I think this is really helpful because I did get a Facebook message from a young woman in one of our northern communities. She said, I hear there's an emergency response team going to Attawapiskat. Could you drop a couple workers off in our community because we don't have any? So I want to go to on the ground. In 2009, we had a horrific suicide crisis in James Bay region, and Chief Jonathan Solomon has spoken eloquently of that. At that time, the provincial workers were laying off staff at Paya Catano because they had spent their budget because they were working around the clock trying to keep children alive. Then there was a big outcry, and then so the provincial government augmented, said they would hire new workers. 2012, nobody was paying attention, they laid them all off. 2014, I was in the communities, and we had children on suicide watch because there was no mental health workers, and the only tool that they had was to take the children into custody and put them into child welfare and foster care because they had no other tools to help these children, and so the children were going to ground. In 2016, we have another huge blow-up of a suicide crisis, and everybody's wringing their hands and saying, how did this happen? It seems to me that if we don't have the ongoing support on the ground to respond to young people when they need it, what we're seeing in northern Manitoba, Attawapiskat, Pakanjikum, that's the result. You have the experience. Can you say what we need in terms of making sure that we're not having to respond in the middle of a crisis, that we're preventing crisis?
Right. That's a good question, Mr. Angus, and I want to refer back to what just took place in the Ontario region. The Premier Kathleen Wynne has been a champion of a number of issues as it pertains to the Aboriginal community and has a very direct relationship with First Nations in Ontario. And as such, as seen with the issues in Attawapiskat and in the north, it was the provincial government that stepped up in most cases first. And recently, with the announcement of $220 million health investment in Ontario focused on the north where it's needed, one of the things that we need to be clear about here at the committee and sending back to the federal government is the Ontario government is saying, listen, we will put 6 new treatment centers in the province of Ontario for First Nations, but we need the federal government to finally come to bat. This is going to be required immediately. What we want to be able to do is we want to be able to make use of those investments in the Ontario region, for example, but we need the federal government to work with us on the capital side now. So I think it's safe to say that there's a lot of people doing a lot of work, and I think the federal government has said a lot of good things. They've made some promises and created high expectations. The provincial government has come to bat now, and I think we need the federal government to move on some of the other issues like capital for treatment centers.
Thank you. I want to close out on that because the fact that the provincial government stepped up in an area of federal jurisdiction with $220 million on the table, the need to get a comprehensive plan, treatment centers, the fact that we have no place to send young people out for treatment. We were told that by Health Canada that it would be utopian to meet the need of how many mental health wellness teams that they've got. They got 10 mental wellness teams now. We asked them, don't you need 80? And they said, well, it would be utopian to get there. They didn't seem to have a plan. What do you think we need to do in terms of closing that gap? If the province is stepping in regions where we have serious mental health and health problems, what does the federal government have to do?
Well, I think we need to make the determination that action is needed now. We can't fall into this cyclical phenomenon of proactive disengagement. We can't keep talking to see no results. We definitely need the federal government to move. We need commitments now. We need to be able to see what the government's prepared to put forward in terms of those investments in values of dollars. And within this quarter, within the next fiscal year, we need action today.
Thank you both. Next question from Mike Bossio.
Once again, Dave, for being here. I always appreciate the way you can articulate the needs of your community very well, very upfront, in a succinct way. And I want to, you've actually done a great job here of outlining the needs from the mental health side and the funding, the $136 million of annual funding. Now, what is the funding that is there today? Is this the 136 million above and beyond funding, or you know, I know I keep talking about the contribution agreements and all these things that happen and the one-offs and the 1 years here and 1 years there and the lack of long-term funding. But given the budget that was released and the investments that were made there, is there any funding in that is specified to this area?
Well, right now, Mike, the National Aboriginal Youth Suicide Prevention Strategy is a program that allows communities the flexibility to develop programming which is relevant to them and meets their unique needs. But the NAYSPS currently funds up to approximately up to 145 of these sorts of projects annually at a price tag of $13.5 million a year, keeping in mind that there are over 630 First Nations in Canada. In addition, this total is not reflective of the resources that make it to First Nation communities. For example, the strategy also provides $1.2 million last year to the Mental Health Commission to develop mental health first aid courses that many First Nations will not be able to afford to send workers to. We simply need to rethink and reconfigure this investment, and the increase is vital. So, Mike, to your point, that there are investments that are made right now, but they're not even making a dent. The 136.
Yeah, I mean, we got 13 million versus 136, 1/10.
Exactly.
Not even a tenth.
Exactly.
Of the funding that's required to meet the and this is a long-term plan that you put forward here because it's annually. And have you done projections out as far as the level of funding you require? I mean, I know we're in a crisis situation now, but is this above and beyond the crisis, or is this we need to deal with this crisis funding? And like any crisis situation, you need to go at it with full force in order to mitigate, to relieve the crisis, and then have long-term funding in place in order to maintain levels that will hopefully make sure from a long-term standpoint we don't run into another crisis. We get out of this cycle.
Right, and let me speak to that because I think it's a good point. I don't think throwing good money after bad is anything government wants to do. But what this 136 million represents is not just let's deal with the crisis and let's deal with the medium and long-term planning. This is all of the above. What this does is it gets boots on the ground, it puts those mental health workers back in the community, but it also brings the teams together in the community so that way what you're getting is on an investment spending side is you're cultivating the orientation of response at all levels in the community. So there's land-based, so for example in Ontario, the investments made are around land-based cultural programming. What we need is the federal government to come in to put these community teams together, so that way this money is staying in the communities, and that it's actually communities that are participating, developing, and implementing the plans, and ultimately evaluating the success.
Now, have you done any other projections in any other types of areas? Once again, I keep coming back to this, and you and I have discussed this before. Is the whole funding model right? Is that we got to get out of this trap of these bloody contribution agreements and grants, so that Indigenous communities can start to set their own priorities as to what they see and maximize the efficiency of the funds going into those communities, right? So has the Indigenous AFN done projections that would from a self-government and from a self-determination standpoint? And I recognize that there are so many differences across the country in programs and how they can be delivered. But has any projections been made in other areas like this?
Well, I think maybe in terms of projections, I can't speak to those, and I know we can get the information for you, Mike. We will do that for the committee. But let me speak about the fact that there's often this thing that happens when we get outside consultants and we get experts in from the outside to come into the communities and do that work. You're seeing automatic leakage. You're seeing more time spent in building trust and building that relationship, and then before you know it, the consultants and the professionals are gone. This way here, the projection would be, there's a value of that type of spending model where you're actually investing in community wellness teams. We've got the plan, we've done the work, we have experts in our communities, we have the land. And I think it makes better sense, and the projections certainly will speak for themselves, that we will see more success if these are community-based and the results and the process stay in the community.
Because I've been to Mistissini in northern Quebec, to the Cree Nation, and I was there in the mid '80s, in '86, and then I was there again in 2005. And the transformation that occurred in that community in that 20-year time blew my mind. Right. I mean, and David referred to the Quebec model earlier. It doesn't surprise me one bit that the suicide rate there is non-existent because of the amount of pride that the community has taken in building a community with recreation centers, with health centers, if you haven't been, you have to go see this, because it is a model of what is possible and the pride that a community. Are there other examples out there that you see from a self-government standpoint, and that where we see what's happening in Quebec is happening in other areas as a result of self-determination and a result of a level of funding and prioritization that is established, that where the suicide crisis doesn't exist?
That I can't speak of right now. I know the internationally the Maori and other Indigenous communities around the world that have a much greater sense of autonomy and recognition. Obviously, you're going to see the results. I do want to just point out one thing as well too. I think recognition of the real issues and giving communities the level of autonomy and recognition for their own healing. We see a Hollow Lake that dealt with sexual abuse issues in the past, and the models that they were be able to put in place at the community level. Alkali Lake in BC, that was part of the initial healing movement in the NADAP program for our people. I think the point here being is that it's a given now that the programs that are supported that are community-based, and if we make the investment there, you're going to see much more success in those models.
Okay, thank you. We're going to move to the 5-minute questions, and just looking at the clock, we're going to have time for 3 of these, and they're going to be from Arnold Viersen, Gary Nandasangri, and Kathy McLeod. Mr. Viersen, please.
Thank you, Mr. Chair, and thank you, Isidore Day, for being here today. Again, really appreciate you being here. We recently heard from Natan from the territory of Nunavut, and he actually brought us a really, I found a very informative piece of paper that talked about risk factors and protective factors. And he also talked a lot about how, because of a lot of things, Indigenous culture, it has been tampered with, has been significantly reduced, and that in some ways suicide is part of the current Indigenous culture, and it's something that especially in the Nunavut anyways, it was something that everybody lived with. Everybody knows somebody. It was all these kinds of things. And so there was a definite sense from him that there was a need to pull the suicide out of the culture and to rebuild culture to some degree. One of the things that he talked about significantly was violence and abuse within the culture at this point, which is generational in some cases. You raised you had a plan there. You were showing us a second ago or a little bit ago, and I was just wondering, how does your plan help to rebuild that culture and to take suicide out of the culture? Because there is significant evidence that shows that when a community suffers from suicide, it's contagious and it continues to grow. So there's a couple of parts to my question is how are we rebuilding culture, removing suicide from that culture, and ensuring that we can remove violence and create strong families. You should probably run out the clock on that, I think.
No, that's fine, and I'm going to try to address that by saying, first of all, thank you for the question. I think it's an important one. So, taking suicide out of the culture. Culture has become probably the central focus of the solutions that are most needed around the issue of suicide. I believe that what we're faced with, again, in my opening comments, I talked about settler colonialism and that there's been a colonial conditioning out of the Indian Act system and within the residential school system. And, we would not be here in terms of the reconciliation knowledge that we now have today if it wasn't for people like Ken Young and the residential school survivors that shouldered the responsibility to convey what the issues were, what happened to them. One of those things was these children, our grandparents, our aunties, uncles, our mothers and fathers were ripped apart, not just from their families, but their communities. So we know for sure that there is no question about it, that the issue of having that identity put back in place, the languages, the connection to the land, the customs, the traditions, those things are so much part of the solution that have never been looked at in the past. And I think that we have to get back again to this notion of a community-based response to that exercise. You will find that our First Nation people will trust more those that have went through a healing process, that have actually dealt with family violence, that have actually come through that horrific time in their life, and who have said, you know what, things aren't what I want them to be, but they're a lot better than what they were before. So healing of our individual community members as well as the families, and that connection to the land and utilizing the land in that healing process is so vital, and it's so obvious now.
You raised earlier. You raised a sheet of paper. You said this is our plan, and we just need for it to be funded. Does that plan include reduction of crime, reduction of violence, and rebuilding of families? And if it does, can you just outline that a little bit for us?
Well, I think this work here, it talks about community comprehensive planning, and within that, community safety is obviously going to be a focus. Each community will have community safety needs, and I must underscore as well that we have other line ministries and mandates within the federal government that are going to have to be involved. Community safety and policing is going to have to be an important aspect and element to this. Community safety as well has to do with infrastructure and having the proper recreation in our communities that create an enhanced quality of life. So I must say that what we're looking at here is the community planning and the community-based process where people all get on the same page, where we employ mental health services at the community level, and we mobilize and we start to create a sense of efficacy in the community so the community can move forward as a whole.
Okay, we're out of time there, Ronald. Yeah, overtime, in fact. You got extras today. Gary has given his time to Michael. Cloud, please.
Thank you, Mr. Chair. Thank you to Chief and Mr. Young for coming here today, and I appreciate the work that you've done in the area of trying to rebuild communities and rebuild the people, the Aboriginal people of your communities, and as we try to find ways to move forward. Like Mr. Young, I also went to a residential school and spent a few years in residence. And for the most part, almost all the young children of the day in the Northwest Territories went to residential school. And that's still very recent. That's still very much in the minds of a lot of the people there. Either they're residential school survivors or they're children of residential school. And we could see it in the lack of parenting skills. We see it in the lack of being able to hunt and fish like their parents or grandparents, our grandparents, and loss of language. So we see it in a lot of areas, and all those losses need to be addressed. But we also see it in the area of addictions. There's so many people in the Aboriginal communities that are struggling with addictions. And I would bet that if we went and started one by one and analyzing the cause, the root cause of their addictions, you'll see it's a result of trauma. It's post-traumatic stress. And a lot of it is from residential school. And the National Chief had indicated that there should be a national strategy on suicide prevention. and the strategy should include adequate mental health supports, recreation facilities, education, and also talked about reconnecting on the cultural side of things. I think there is a real cultural disconnect that's causing a lot of problems. Now, you've talked about your plan. Do you agree that there is a need for a national strategy, first of all? And does it kind of reflect what you are talking about also?
Yes, and I want to reiterate that strategy that the National Chief talks about, I'm bringing the representation of his ideas around that plan forward today as the Chiefs Committee Chair on Health, and I do believe that that strategy is required. I do want to focus again for a second on the issue of addiction, and I do want to bring you back to a point in history when back in the 80s, early 80s, the NADAP program was coming onto stream in this country, and there was an alarm rung that the alcohol addiction in our communities was crippling our First Nations, and it was killing our families. And what happened was the federal government, through a cabinet approval process, gave recognition that it must always support addiction programs. So the NADAP program was created. And I understand by that type of political will and investment, much of the healing and much of the strength you see in our First Nation communities today was as a result of the NADAP program. But what has happened is there's been reduced funding. There's been a dwindling down, a watering down of that investment, and we need to bring that back up. So I think to your point on suicide prevention, we still need a heavy emphasis and focus on addiction, and I might add that the face of addiction has changed. The OxyContin issue and the opiates have done so much more damage. We should have left the NADAP program alone. We should have continued to invest, so addictions is a strong point in the strategy.
I just wanted to talk about delivery agents. We heard from Jack Hicks yesterday on some of the studies he's done. He's talked about current programs that are there that haven't been expanded, like Aboriginal Head Start and friendship centers that need to be used, that should be looked at and expanded. Can you talk about how these would work and how these could be used as agents?
Well, I think it's going to be really important to recognize that, again, when we see our First Nation people and the condition of many of our First Nation communities, we're seeing an out-migration of our people going to urban centers and finding themselves falling through the cracks. I'm a proponent of strategic partnerships, and I think it's going to be really important as we look at the health and the continuity of services. Those delivery agents and the programs that are very desperately needed are across the board, no matter where our First Nation people go. So I think we are going to have to take a serious look at suicide prevention being fluid throughout all organizations, and we're going to have to create a culture of partnerships in this work. So your point is well taken.
Okay, thank you. Final question from Kathy McLeod, please.
Thank you, Chair. Thank you again for the presentation and joining us again today. You appropriately recognize there's a whole continuum, and of course you need to engage in all the different points along the continuum. So I want to focus in on the aspect where you've been talking basically primary care, primary prevention, the wellness workers and the programs that are offered. In British Columbia, of course, we now have the First Nations Health Authority, who have actually combined the money, of course, from the federal government. They have some from the health authorities, some from the province. From your perspective, is that something that other communities are looking at, and is it something that has been supporting, more effective delivery? Because, of course, I would assume there's some flexibility, and so how's it working? Is that something that would be helpful?
Absolutely, and as the Chiefs Committee Chair on Health, one of the things that we have come to an agreement on is that we need a health Health Accord task team for our First Nations to go across the country in all of our regions and look at what the issues are, look at what the best practices and models are. We will be ending up in the BC region in some of that work and looking at the success in that particular region. And I want to, again, underscore and point to the Health Accord negotiations are going to be so vital going forward in looking at those strategic relationships with the various health providers across each province and territorial government. So I have to, again, say that those relationships and innovating the partnerships are going to be vital. In Ontario, again, I'll say the recent $500 million by the Ontario government is a huge marker in terms of where other regions need to go. And I think Canada, working with its partners and recognizing, a collective effort towards Indigenous health across the country is going to be important.
Because here I see that all the partners have actually put the money into the First Nations Health Authority. So rather than the province maintaining control, it is the health authority that looks at both the wellness programs and how the nursing stations are running, and so a good spectrum in that primary care area. I'm going to do a quick deviation a little bit away from the topic, but it sort of builds on something that Cindy Blackstock said, and it's something that we talked about in the Murdered and Missing Indigenous Women, and there's certainly, and I really want your perspective, they talk about the need for data and statistics and information that's not there in many different areas. I remember in the 80s, in British Columbia, as an example again, there was identification on the healthcare card, and at that time, people were very angry about that because, of course, they said, there's no other group that is sort of, spelled out in terms of, for statistical analysis. And so that was taken, they recognized that the First Nations communities were offended by having data collection done in that way. So can you talk to me, first of all, data collection important, but how do we do it in a way that's, how do you see that we can provide the information that you need to run programs, but not be intrusive?
Right, and I think it's a very good question, and at the end of the day, governments will always require data. They're going to require aggregate information to be able to make assumptions and design programs. The issue is going to be control and jurisdiction. And I think we've come to a point in time where First Nations have become much more educated. If we had governments continuing to work with us on building up our statistical database, this is going to be an issue of First Nation control and co-jurisdiction, if you will, and helping build institutions like health authorities. And it will be important that we start to define what First Nation jurisdiction means. I'll go back to the Royal Commission on Aboriginal People, and I'll again make the point of the self-government agreements, the modern self-government agreements, where that jurisdiction and that authority rests with the First Nations. I think it's going to be important, data and the information required to design effective programs and evaluate them, but the control and the jurisdiction needs to be recognized from a First Nation perspective. And I think we've got to sit down and have that discussion and figure out how we start to dismantle some of that bureaucracy within Health Canada, and we start to affect central government and start placing those controls and those structures in the hands of First Nations.
And do you think your community members would be supportive, or would you think your community members might be a little bit nervous?
I don't think it's individual communities either. I think we've got health authorities like SLIFNA, if you will. We've got groups of First Nations and authority models already being developed. So I don't think it's one community. I think we're seeing models right across the country that are ready now for self-government in the area of health authority.
Thanks.
Thank you. Thanks for that. We've come to the end of our time, and on behalf of the committee, Regional Chief Day and Mr. Young, thank you very much for sharing your time with us today. We're very grateful for that. Before I ask for a motion to adjourn, I just have a quick question on an unrelated matter for members. The Minister of Indigenous and Northern Affairs staff has asked me to put a question to you. Earlier this week, the minister tabled Bill C-17 in the House, YESA, Yukon Environmental and Socio-Economic Assessment Act. And typically, we wouldn't get the background information on that bill until it's redirected to us for study. That hasn't happened yet, but the minister's staff is offering that background information now. If we'd like to have it, it probably wouldn't be redirected to us till the fall. So it's just an offer to have the stuff up front a little bit earlier. It's a sort of little technical thing, yeah. So if everybody's willing, I'll just let them know that they can forward that.
Yeah, that would be outside committee. It would be a technical briefing, would it not be, on the bill?
I didn't hear this phrase technical briefing. It was called background information. It's documents. Yeah. Sounds good? Okay. Thank you very much for that. May I have a motion to adjourn? We're adjourned. Thank you.